Colorectal cancer, if diagnosed very early, is a curable disease. Diagnosed at a later stage, and I mentioned to you the classification, eyes, the kidney, and the brain to spiral out of control. Sad to say that I've noticed metabolic syndrome in our population in Richmond Hill much more than I've seen in the general population of the United States. Our incidence of metabolic syndrome is extremely high compared to other populations. And I do not have to ask you to do more than look around and tell me if you have not seen a picture looking like this, maybe a little bit more pigmented, but the kind of person who is sitting on a stool, we may have a drink in one hand, we may have a cigarette in the other hand, we're looking very jolly and nice, our necks are fat, our shoulders are the way they are, our abdomen is plump. We've got incidences of metabolic syndrome. And the average one of us, of which I am part of, is that basically we have the increased incidence of the diabetes, the high cholesterol, the hypertension, and the obesity. And let's dissect each one at a time and find out how is it we can control the onset of this cascading effect of damages to the heart, to the eyes, and the kidney, which is really the entire body that we're damaging. Because once we start to damage the vascular system, every organ of the body obviously is supplied by blood, and it will be damaged. Albeit is the reason why we seek admissions to hospital is obviously because of the stroke, because of the heart attack, because of the amputation due to the diabetic, because of onset of renal failure, because of the sudden loss of vision in the eyes. It is the end organ damage that brings us to the physician and to the hospital. It is not the seeking the treatment. In a lot of cases, sad to say, it's not the seeking the treatment of the one or two factors that cause metabolic syndrome. So metabolic syndrome is here to stay in our population. It's important for us to understand it now as a disease process. And once we see we have more than one factor that is going to contribute to this syndrome, then we need to be very vigilant in our health in terms of maintaining and controlling our pressures, our sugars, our cholesterol, etc. In metabolic syndrome, and always remember this picture of this smiling gentleman or woman who has got both the diabetes, the hypertension, the high cholesterol, and the truncal distribution of fat. This is the same person having absorbed the amount of sugars from the food they intake. It's like when you want to develop gum disease. How do you develop gum disease? Eat a lot of candies, do not brush your teeth, expose your teeth to a large amount of sugar and bacteria, you will develop gum disease. The analogy of that is very simple. You want to develop metabolic syndrome, here is how you develop it. Continue to eat a large amount of sugars. The large amount of sugars, they're not absorbed because there's not enough insulin, and we do have a relative insufficiency of insulin. That combined with the high cholesterol that we all face with, combined to make the distribution of, let's say that's the sugar molecules, let's say that's the cholesterol molecules, now we face with the development of atherosclerotic plaques, atheromatous plaques that are formed within the blood vessels. These are the same blood vessels that go to the heart. These are the same blood vessels that supply the brain. So what we've now actually caused is a generalized effect of atheromatous plaques throughout our entire body. And there are many of us who suffer with the genes that cause us very high cholesterol. But we combine that with the fact that we bring on diabetes due to a relative insufficiency. We're predisposed to a relative insufficiency of insulin. But we decide that no, we want to be involved in activities of a sedentary lifestyle, no exercise. In addition to that, we love to eat the sweets, we love to drink the alcohol, we develop this truncal fat. Worse for the truncal fat is not the fact that it looks ugly alone, but it also is an increased incidence of insulin resistance caused by truncal fat. This is a condition in which you have insulin, but instead of when you are a slim individual of ideal weight for your height, the amount of insulin being produced took care of the sugars that you eat. Now, with an increased amount of truncal fat, we've decided to develop insulin resistance. Very, very dangerous condition to develop. Because once you start to develop insulin resistance, you will now never be able to respond to the insulin you produce, even though small amounts, or even exogenous insulin. So you have removed what should have been a life-saving medication, which is insulin, to prevent the early onset of diabetes. So combine that again with the metabolic syndrome, which we're now going to introduce as something that we do have common in our community, and combine it with the fact of obesity. Obviously, we know what obesity is, over 20% of your body weight. But it is known that people who have metabolic syndrome, their waist dimension is usually greater than 35 inches in women and over 40 inches. On average, ask your average friend, do we have a waist circumference as a male over 40 inches? Yes, and a lot of us can say. And it's sadly to say, it's probably over 50%. And what I have noticed in my practice is that I'm seeing a large and increasing number of younger individuals who are presenting with metabolic syndrome, the truncal obesity, the early onset of diabetes. I've got a 14-year-old guy in my practice of very well-educated parents who has recently been diagnosed with metabolic syndrome. His triglyceride is also extremely high, which is the other factor we face upon. And the presence of the increased triglyceride, which in the past was not really incriminated as much in terms of increased heart disease. Now, with the addition of metabolic syndrome, an increased triglyceride of over 150 has actually shown to have an increased risk of developing metabolic syndrome. So understanding metabolic syndrome as a disease is not to think of it just basically as one disease, but it's a combination of diseases that we as a race, we as a people, we have a particular set of genes that drive us to work hard, to do the best we can, to go as far as possible in life, but we also have disease conditions which are much more common. Metabolic syndrome is one you should remember. Common things being common in medicine, low back pain, there cannot be a more common topic in medicine. Low back pain we've spoken on numerous occasions, but I saw this poster and thought how applicable it was to just describe some of the common things that we see as causing low back pain that are not attributable to the spine. But I'm also going to show you some of the causes that we have as low back pain that are attributable to the spine. In our first discussion, we look at obviously the lumbar spine and the spinal cord as it passes through and ends at the level of S1, where basically you cannot get damage to spinal cord here at this level. But this is the spinal cord with the 5 lumbar vertebrae and the sacrum itself. Each vertebrae itself being separated by the intervertebral disc and the spinal cord that travels in the canal, the spinal canal, posterior to the vertebral body. So anytime we have an injury to the lower back that involves the intervertebral disc, this disc itself can now impinge onto the spinal cord. And we all have heard the cases of intervertebral disc disease, or we've got a pinched nerve. The pinched nerve is just a description of what is happening to the nerve. The etiology of it, whether it be due to the lumbar vertebrae itself that is impinging on the spinal cord or its intervertebral disc, the outcome is the same. When the nerve itself is compressed, then you lose the sensation associated with either the motor fibers or the sensory fibers within the nerve itself. So just to imagine that the spinal cord itself is not just a homogeneous mass. It has electric cords that go analogous to an electric cord that sends different impulses, whether it be motor impulses to make us move, sensory impulses to control our bladder and our rectum to knowing when it's full. So when that nerve is being compressed, it's not being compressed that causes just motor weakness or weakness in the legs itself that we commonly complain about, or pain that radiates down to the back of the leg. It can cause different things like numbness down to the back of the leg because it is compressing the posterior column, which controls vibration and proprioception. So it's very simplistic of us to say we've got a pinched nerve and say I've got a pinched nerve, so that means I have pain. That's not the real thing. You're having pain due to a pinched nerve because you have an injury to the lower back. And it's not the pinched nerve that's causing the pain. It's the evidence that most pains, 85% of pains of the lower back, is not because of the nerve itself, it's because of the area around it. It's really musculoskeletal pain that involves the muscle, the fascia around the vertebral body. So one of the ways in which we can actually decrease the pain is by trying to strengthen the lower back, either by increasing the amount of exercise, decreasing our weight, by the therapy we apply on the acute pain, and try and manage the chronic pain as best as we can with our exercises, with our physical therapy, with our medication only when we need it, especially when there's exacerbation of pain. But also to be prudent that we need to avoid the exacerbating factors of low back pain, avoid standing for long hours, avoid sitting for long hours. If we have to stand for more than an hour, sit at least for 10 minutes. If we have to lift a heavy object, remember not to just lift with your back, lift with your legs itself. Bend your legs so at least you're able to accommodate the weight as it is. Because low back pain in itself, to say that, oh, I'm getting pain in the back, and that's equivalent to a pinched nerve. When you get a pinched nerve, you're losing vibration proprioception, you're losing motor function, you're losing sensory function. So equivocating low back pain and saying, oh, it's because of my intervertebral disc. No, your intervertebral disc is going to cause a numerous amount of pathology. And it doesn't have to be just the intervertebral disc that's compressing it. You can also have called Equina Syndrome, in which the spinal cord is being compressed by the bones itself of the vertebrae. It can also be compressed by obviously we know the herniated disc, which we all mentioned, because the disc itself is controlled and it's kept in a capsule, the nucleus pulposus, and it remains inside it. When we herniate the disc, then it can spread out was indefinite, can cause compression much more than bony compressions are, and much more acute in the nature in which it occurs. These are the important parts of low back pain itself, the damage to the spinal cord. But equating it and saying because of the damage to the spinal cord, I'm ending up with a numbness of the leg, it actually has to do not with the pain at the site itself, but more to do with the nerve that's being compressed. In the next discussion, we'll try and look at the other causes of low back pain that has nothing to do with the musculoskeletal system. Low back pain, very, very common. But in order to have at least a general knowledge of low back pain, let us revisit the spinal column. And all of us are aware what the spinal column looks like, and this is a representation of this gentleman that shows there's 7 cervical spine, or the ones that make up the neck itself. They have the thoracic spine, the ones that we actually have from the neck, coming all the way down from the neck to the end of the ribs, and basically as the ribs spread outwards in the sternum, we have them inserting onto the 12 vertebrae of the thoracic spine. So we have the 7 vertebrae involved in the neck, that's involving things like whiplash injury in motor vehicle accidents, to a minimal trauma of punches in the face that I'm seeing commonly in nursing homes these days, and the thoracic spine, through which the thoracic cage is made up, and where the ribs themselves insert as they come from the back to the front and insert into the sternum, exposing that V-like shape within the abdomen itself. Then we also have the lumbar vertebrae, the 5 lumbar vertebrae, the ones that's most commonly involved in injuries at the workplace with heavy lifting. And these are the 5 lumbar vertebrae. The sacrum itself, or the buttocks area in which we actually sit on the coccyx, but the sacrum is that portion of it that's behind the buttocks area. Looking at the vertebrae itself, the atlas itself allows us to be able to rotate the head, and stiffness of the head and inability to move can be a problem with the atlas, or can be a problem with the muscle and the spinous processes and the anterior and posterior spinal ligament that actually help to support the neck itself. Obviously, it's bones that's sitting on bones, cushioned by the fact of you having this intervertebral disc, which is almost a gelatinous material that allows the luxury of movement of the neck, that allows us to do things like flexion, extension, medial and lateral rotation of the neck. And these are all brought about because of the fact of small bones that sit on pieces of spongy material. The spinal cord, which obviously supplies the sensation that goes from the brain itself all the way down to the legs, obviously travels within the spinal column, and posterior to the vertebral disc is where the spinal cord runs. But in order to supply sensation to the arms and to the legs, the spinal cord, as it runs through within C5, C6, C7, T1, supplies sensation involved with the arm itself, and as it supplies sensation to the legs, it comes through the intervertebral body, and then it forms a complete, from coming through these areas, as it comes through the spinal cord here, it actually forms this unique, the sciatic nerve, that basically is formed from the combination that comes through the spinal cord in that area. So any portion of this that's damaged, whether it be through an area through where the intervertebral disc has damage, is going to cause pain that goes down the back of the leg or numbness in addition. It can also cause various other problems as it comes through the spinal cord. Injury by itself, by and large, is probably the most common cause for us to have spinal cord problems. Injury either related to a motor vehicle accident, an accelerator or decelerating injury, whether or not we hit someone or someone hit us. Basically, the whiplash injury caused by the neck, the propulsion of the neck backwards, is going to cause compression of the nerve itself, because you're going to get subluxation of these vertebrae that sits one on top of the other. You can get the intervertebral disc being damaged, that can actually cause compression of the nerve itself. We can also get injury to the lower back, even while it's in a sitting position, obviously on being unaware of that force from behind that caused the subluxation of the vertebrae one on top of the other. But there are other causes other than injury that can cause us to lose, can cause us to develop loss of sensation to the peripheries itself, loss of vibration, proprioception, or even sensation, and those are caused by the bone disease, which I'll discuss at a later stage. And as our population ages, so are these symptoms increasing. So not only an injury to the spinal column itself and intervertebral disc, it's also the aging process and the bone distribution that can cause it. Continuing our discussion on low back pain is to look at some of the more common causes of low back pain that arises from the spinal cord and the spinal vertebrae, and some of the causes that do not have anything to do with the spinal column itself. But just to look at what a typical vertebrae looks like will make us realize that it's not as simplistic as sometimes we make it out to be. That's what a common vertebrae looks like. This is the posterior aspect of the part of the back with the spinous process and the bony areas. This is where the spinal cord runs. And what I was alluding to in the previous discussion is that the spinal nerve root that comes through that opening is the one that can become compressed by the intervertebral disc. So this is the spinous, this is the vertebral body. That's that firm body that helps us to support the spine. We need movement in the spine, so we've had to make it up. God made it up into small bones. We need to have a cushion that bone doesn't rise against bone. Hence, we have the intervertebral disc. We have to have a method in which this nerve, this big wad of cord that supplies the electricity from the brain to the rest of the body, passes through an opening. That is the intervertebral, that's the vertebral canal that it passes through. But it also, as it passes through, needs to supply tributaries to give a sensation to the hands, to the face, to the legs itself, and hence it goes through the nerve root travels through the vertebral openings here. And it's a very intricate system, but albeit enough to say that it's very complex in the way it is, and hence injuries to the lower back itself or low back pain should not be taken lightly. Obviously, in order to get the blood supply, to supply nutrients to the intervertebral disc, to the bones themselves, to the nerve itself, it has to have its own blood supply. So that each spinous process, each vertebral body itself, is a very intricate thing made up of the spinal cord, the nerve root itself, the nerve sheaths, the blood supply to it, the nucleus pulposus and the annulus fibrosus that actually separates the bones from each other. And we understand that it's an intricate mechanism enough to say let's avoid damaging it, or if we have damaged it, let's at least try and repair it as fast as we can. and also realizing fully well that once it's damaged, it's prone to develop further insults. It's going to make it worse. So it's important for us to make sure we listen to our doctors, understand what we need to do to decrease the pain, because the pain is just a symptom of the disease process that is causing all of this to go haywire. Let us look at the function of the intervertebral disc. That same disc that we basically damage, it is what separates the bone itself, prevents bone jarring against bone, and it's separated by the nucleus pulposus, which is the content inside of it, which is the gelatinous material, and the fibrosis, which is on the outside, that keeps it intact. And it allows us the cushion of being able to allow the impact of bone against bone without feeling a pain as a result of it. Osteoporosis, as we all are getting older, increased incidence of kyphosis and scoliosis will cause the intervertebral disc to become compressed and irregular, because the bone itself is being destroyed, but it's not being destroyed in a regular fashion. It's being destroyed in totally irregular fashions and can cause compressions at various parts. Some of us can have very bad looking x-rays of the spine without having any degree of intervertebral disc compression. Then some of us will have beautiful x-rays and a tremendous amount of pain, just because strategically the intervertebral disc is compressing the spinal cord. In this case of the gentleman with hyperkyphosis, when the back is curving outwards, or scoliosis, which is much more common in young girls, especially young teenage girls who are growing, in which the thoracic spine is actually twisting. And also in addition of hyperlordosis, either by us having bad posture or not wanting to correct it as children, or carrying heavy loads as well. The causes of low back pain that's important to the spinal column that we mentioned before is, obviously we know that the bony spurs actually from the intervertebral body, the disc disease from the intervertebral disc that actually is causing compression of the spinal cord, the spondylosis and the spondylolisthesis from the bony protrusion from the vertebral body can also cause that. We mentioned herniated disc, and actually fractures involving the spinous process or the other areas involving that vertebral body. Well, what are some of the other common causes of low back pain that we commonly see that has nothing to do with that portion of the body? We can develop as a general bony disease, ankylosing spondylitis, which actually cause the bone itself to become like a bamboo spine, so it's much stiffer than usual and it's not able to bend as much. We can have bony tumors presenting in the spinal column itself. Much more common in the past was infection involving tuberculosis, which will cause a discitis and actually cause infection involving the vertebral body itself, and actually seen a fracture caused by someone who's had tuberculosis for many years. We can also have an aneurysm of the descending aorta that can cause compression of the nerve of the area involving I've actually seen a case of actually erosion on a post-mortem specimen of the spinal column. You can also have the sacroiliac joint being involved, nothing to do with the spinal column, a pelvic tumor, and any pathology within the pelvic area can cause severe amount of pain. Much common in our older population is cancer of the prostate that spreads to the spinal, to the backbone itself, as being one of the more common causes of sinister low back pain. So low back pain, a very common symptom in medicine, but also that has relation to the lower back itself, and something's not related to the lower back should be checked out by a doctor. It's an intricate mechanism. We preserve it as best as we can. We try and protect it as much as we can in terms of preventing further exacerbation of injuries, and also try and at all times adhere to what is common principles of trying not to lift too many heavy stuff, trying not to sit for and stand for more than an hour at a time, and when you get your back pain, have it investigated very early.